Welcome to Health Update Extra, Rockford Health System news and information you can use to make informed health decisions. In this segment of Health Update Extra, Dr. Juliet Ugarte Hopkins, a pediatric hospitalist at Rockford Memorial Hospital, discusses how the H1N1 virus spreads, the proper way to cover your coughs and sneezes, and why children are more susceptible to acquiring the virus. How does the H1N1 virus spread?
The H1N1 seasonal influenza viruses and pretty much all of the viruses that we know of are spread primarily through what's called respiratory secretions. Now, this includes saliva from the mouth, mucus from the nose, and this is one of the reasons why everyone always says cover your cough, cover your cough, cover your cough, and your sneezes, by the way. The reason is because within these particles of fluids is where the influenza virus is and how it can be spread. Because if you're next to somebody and they cough or sneeze without covering it, these very, very small microscopic particles end up spreading out into the air, and as disgusting as it sounds, if you then breathe those particles in, many times without knowing it because they're so tiny, you then in fact can get infected by this virus. This is why they talk about covering so that you don't have this spread. And the way to cover is not with your hand, it is with the crook of your arm, or if you carry around or if you have next to you some Kleenex, that you use that to cover up your sneeze or your cough. Now, the reason why you don't want to use your hand is because if you do that and you don't immediately go to wash your hands or use a hand sanitizer and you touch a surface, the next person who comes along and touches that surface can then potentially pick the virus up. And then if they go to touch their eye because there's something in it, or if they yawn and touch their mouth, or anything else in which they now get that virus from their hand into their mouth, nose, or eyes, they then infect themselves.
Why are kids more susceptible?
Because as we all know, anyone who spent any amount of time with a child, they're not really the best at covering their coughs and their sneezes, and many of them really don't even know how to blow their nose. Many children really don't acquire that skill until they're about 3 years of age. So if you're with a toddler or a baby, you know that they're perpetually running around with boogers coming out of their nose, or they're wiping and they don't care, they're coughing on each other. And so this is something too why children very much are more susceptible to catching this illness and viruses in general, simply because they're always drooling, they always have snot everywhere.
Touching a surface, what you need to know.
One thing that's important to remember is that viruses can last on surfaces such as tabletops or doorknobs or toys for anywhere from 2 to 8 hours. So even if you don't actually witness somebody cough in their hand, touch the table, and then you come along and touch it, it is still very likely that you could potentially infect yourself by touching a simple surface such as that. That's one of the reasons why it's very, very important to, as much as you can, wash your hands with soap and water, or use an alcohol-based hand cleanser whenever you really think about it, because we're surrounded by the virus everywhere, and everything you can do to protect yourself is just going to help you and your children in the long run. Another thing that's important too to remember is try to avoid touching your face as much as possible. A lot of people do it, especially women. We're always fixing our makeup, but men too, and children for certain. So try to make a concerted effort not to be touching your face, and that will help as well.
Health Update Extra is produced by Rockford Health System. Become a subscriber to the Rockford Health System YouTube channel, or become a fan on the Rockford Health System Facebook page, and you'll receive notices on future Health Update Extra topics.